Cardiac surgeons. Well, everyone knows they exist, but until you really need one, you don't really know who to call. But I think after you speak with Dr. Brian Bethea, you are going to figure out that he may be the one that you want to entrust your heart to. So what do you think about that, Dr. Bethea?
I think it sounds like we're off to a good start today.
Entrust their heart. And that must be, when I think about that, I know that you have good bedside manner and you sit and talk to someone, and then they're put to sleep, and then it's all yours. So what do you think about?
Well, what I think about is during the initial office visit, what I often tell patients is that I was sent to school forever so that I can give them the information so they can make the best decision for their body. After all, it is their body, and I'm really just a surrogate for them. And in the operating room when they're asleep, I'm their advocate. And so I need to know everything that they want so that I can make sure that we can accomplish all of the goals for the procedure.
That's a very good yearning. Tell me who comes to see you. When do you see that person? When someone refers them to you?
Yes, most of the time they're usually referred by either a primary care physician, internal medicine physician, or cardiologist. There are some patients, though, that are their own advocates, and they will what we call self-refer, depending on their area of need. Right,
but how do they know they need you?
They oftentimes will get a diagnosis from another physician. Most of the end-stage disease that I deal with is usually based on an echocardiogram, which is just an ultrasound of the heart, or they might get a CT scan or potentially a left heart cath.
All right, and so once that happens, then they have to figure out, what's in it for them, and they want to know, of course, who they can trust and who has the most experience. And then also, it always comes to, pardon the expression, bedside manner, because you've often heard this. Oh, he is the best surgeon, but he's not a very nice person. And I thought, why would a doctor want to have that kind of reputation?
It baffles me. I don't really understand. I learned way back in medical school that patients always know what's wrong with them and that they understand their dis-ease, not necessarily the disease. And if you don't have a good relationship with your patients, then you can't be the best doctor that you can be. So it's a team relationship, both between the staff that I work with, but as well as the patient and especially their family members, in order for them to achieve their best outcomes.
Right. Really, it's a comprehensive care, as we say. Tell me what a team would consist of if you are now working to do an operation.
So when it's in the hospital setting, we have the operating room staff, which consists of nurses, anesthesiologists, perfusionists, as well as an assistant in the operating room proper. And then post-operative, there's a giant team that the patient interacts with, ranging from ICU nurses, floor nurses, physical therapy, occupational therapy, nutritionists, consulting physicians, cardiologists, pulmonologists, endocrinologists. So it's really a very vast experience. They come across a lot of people. They're not the type of patient that is going to be sitting in the room alone for hours upon end.
That's good news. So when I drive by Delray Medical Center, which I live very close to you, on Linton, as a matter of fact, it's a great hospital, and you always wonder what's going on in there.
Yeah, so that is a great question. What's going on in there? And in my world, we're really trying to be the leader in cardiac care. We're bringing a lot of advanced therapies. We're bringing new technologies. We also rigorously follow the available data to make sure that we're providing all the services for our patients in order for them to not only achieve their best outcome, but we're there to not only just extend their life, but also get them back to where they were before they started not feeling as well.
Yep, that's a wonderful goal. So Dr. Brian Bethea, who is a cardiac surgeon, and he's affiliated with Delray Medical Center. And if you would like to have some information, you can go on the web to Delray Medical. It's ctr.com, delraymedicalctr.com, or you can call him directly at 561-638-9140. People have now said that, I think it used to be, well, maybe it still is, that heart disease people die more from heart disease than cancer. Is that true?
Yes, that is still true.
Well, what are we going to do about that?
Well, there has been a lot of initiatives on preventative medicine or preventative measures. Seeing physicians regularly, understanding, not only medication that you can take, but it starts before that with proper diet, nutrition, exercise. We really need to get the word out that more and more we understand that those three factors do contribute a great deal over a patient's lifetime.
So would you be working with a cardiologist first, and then you do the surgery, which of course he or she cannot do? Is that how it goes?
Traditionally, that is exactly how it went. We're very progressive at Delray, and we believe in the heart team approach. And so no longer do we consider ourselves cardiologists or cardiac surgeons, but a cardiovascular care provider, meaning the cardiologist and the cardiac surgeon work side by side. We review the patient's information as a team beforehand. We review it with the patients as a team, and then we also take care of the patient both before the operation and after the operation as a team, which is rather unique in this environment.
Well, I will tell you something that I happen to be a gerontologist, been doing this for a long time, and I was always invited to talk. And I once was invited to a support group, and they called themselves the Zipper Club. And I thought, what's a Zipper Club, And I went there and I thought, is this something sexy? What is the Zipper Club? I didn't know. And I got there, and of course, you know what it is, and I'll just tell our audience, it's where everybody who's had any surgery to the heart, usually there was looked like a zipper from the neck down, right?
Yeah, that is also true, but that also has changed recently. We actually no longer have to open the patient's chest for certain therapies. For example, isolated valve disease. If the patient's the right candidate, we can replace that via catheter in their groin. If they have aortic disease and they're the right candidate, we might also be able to fix their aorta from the inside out via catheter in their groin. Any isolated valve surgery we try to do through very small incisions. Even we're getting ready to launch a left ventricular assist device technology as well as potential heart transplant. And the left ventricular assist devices we can put in through smaller incisions. And we take great pride in trying to minimize the number of patients who have the large incisions any longer.
That's excellent news.
It is excellent news because we do know that the patients tend to recover quicker, they return to their life activities faster, they need less blood products, they spend less time in the ICU and then also in the hospital.
So my question is, if you don't want to give a person anesthesia, the kind of surgery you do, could they ever have a spinal?
There are some rare procedures that we are able to do through local and spinal. It's more of the catheter-based technologies that I'm referring to. But in general, you really want safety first. And so while that may sound very intriguing upon initial impression, it may not be your safest option.
All right. Well, that's something, of course, you discuss with the patient. I'm glad that you have enough knowledge that you could just say, no, that's not going to work for us. We want to be careful. We want you to come out, singing and dancing, and we don't want to have any problems. You also talked about, now, there's something new. I know the interventional radiology. Are they doing heart, something like what you were saying, that they go through the groin? But maybe it's not what you're talking about.
No, you're on the right path. It's actually an interventional cardiologist.
Oh, interventional cardiologist, yes.
Yes, and that goes back to our heart team. And so to do the transcatheter aortic valve replacement, or TAVR as it is known here in the United States, it's called TAV in Europe. The cardiologist and the cardiac surgeon work side by side. We see the patient together in a single office setting so the patient doesn't have to make multiple trips. We do have to get a couple special tests, but we try to organize that all on the same day so that the patients don't have to make a lot of trips. You're really looking at 2 trips to the hospital in order to get all of your diagnostic studies completed, and then we can proceed. And then in the operating room proper, which is more of a hybrid room, which is exactly what we're doing since we're functioning as a team and our two worlds are melding together, but in the hybrid room, the surgeon and the cardiologist stand side by side and perform the procedure together.
That's excellent. So you have a real team member there, and that's really why I think a lot of people are living longer, because they have so much expertise that's working for them.
I would agree with that. I think that we've improved by physician standards. We know more. We practice evidence-based medicine. we place close attention to our quality and our outcomes, making sure that our patients can achieve the best outcomes. But also we have help from the industries, and the technologies that they're bringing to the table are far advanced compared to where we were just 10 years ago.
Well, I know I've worked with Medtronic, and there is now we have electrophysiologists, right? Do you have one
correct.
of those?
We actually don't have one. We have 11 electrophysiologists.
11? Oh, my heavens.
Yes, we are very well equipped at Delray to handle all of the arrhythmia needs of the patient.
That's fantastic. So for people that don't know why you would need one, why don't you explain about that?
Anytime that your heart is not beating in what we call sinus rhythm, which is the lub-dub, anytime it's beating out of rhythm, you might feel fluttering or palpitations in your chest. You may even feel lightheaded. There's the potential that you have an arrhythmia that may need to be addressed. And
that would be done through?
A combination. Again, this is, I've said it once before, I think, but we work as a heart team, and there are certain arrhythmias that are better served in the cath lab. There are certain arrhythmias that if you come to the operating room for another procedure that we can handle while we're in the operating room. And then there's also the realm of arrhythmias where, again, the surgeon and the cardiologist are working side by side and trying to fix the arrhythmia, bringing the best of both worlds again to the patient.
So is your expertise pretty much with adults, or is there someone special that would deal with an infant's heart?
Yes, we have Dr. Michael Black, who is an excellent congenital heart surgeon, and he also does the adult congenital patients too. It's a fascinating feature that in today's world there are more adults alive with congenital heart disease than actually children alive with congenital heart disease in the United States, and that's because, like other fields of medicine, their field has become so good at keeping these young babies alive that they used to not be able to, that they're now growing into adulthood and achieving normal life expectancies. And he works with a cardiologist, Dr. Gardner, who's an adult congenital cardiologist. So again, you're hearing a heart team where the patient's getting two sets of eyes for the price of one.
That's excellent. My guest is smart. He is smart and really on the ball here. It's Dr. Brian Bethea. He is a cardiac surgeon there at Delray Medical Center, and it's a very, very nice center. In fact, for those of you who may not have seen it, it's right off Linton and Congress, and it's been there quite a while, and they're very proud of what they do. I know that. Do you also have a trauma center there? I think you do.
We do. We are a level 1 trauma center. So
yeah.
That's the highest level of trauma center that you can have.
Wow. So let's go back to something. So someone's having dinner, they're out in a restaurant, and all of a sudden their heart, something happens, they start to have a pain. How did they know it's not indigestion or that they need to go to the emergency room?
That's an excellent question, and in general I would say you don't know. You don't know, so you need to potentially get checked out. Obviously, I think the first move that all of us would do would be to take some type of over-the-counter remedy, but if that doesn't cure the pain, then you need to seek medical attention right away.
And what would an over-the-counter?
Well, if it's chest pain, I would recommend that you have that checked out immediately. Mm-hmm. But if it's indigestion, any type of antacid, but oftentimes myocardial infarction or heart attack can mimic indigestion, and so if it doesn't go away, we don't want you waiting. We want you to come and be evaluated.
Okay, so that's great. Well, of course, that means go to the emergency room, but you have to think about it. You don't want to wait till it's too late. So just what Dr. Bethea said, just if in doubt, go and check it out. And so, Dr. Bethea, thank you. It's so good to know that you're there and you're so close here in Palm Beach County for people. I'm sure that a lot of your patients are listening, and we will get you on YouTube. So I think I have a photo of you too. I know I do. And once the show is aired, we'll have a lot of people be able to hear what you said. It was pretty valuable information.
Well, thank you very much. I appreciate both your time as well as the time of your audience.
Yeah, it was a wonderful conversation. So thank you, and good luck with everybody.
Thank you.
All right. Bye, Dr. Bethea.
Bye-bye.